Good morning, everybody. Welcome to our 5 Wishes workshop via Zoom. My name is Louise Joyce, and I'm the Director of Community Development at Yolo Hospice. Your Yolo Hospice team for today's meeting is Liz Romero, Yolo Hospice Community Ambassador, Andrew Moore, Yolo Hospice Volunteer Manager, Ellie Slavin, Citizens Who Care Volunteer Coordinator, and Daniel Ramondio, our Marketing and Communications Specialist. Our team will be working silently in the background to help ensure a successful workshop. As a convenience to you, we are recording this series. As a participant, the link to the recording will be available to you via email next week. A little about Yolo Hospice. We are the first established hospice in the Sacramento Valley. We have the longest regional track record as experts in caring for people who have a life-limiting illness. We currently serve more than 180 communities in the 5 counties of Yolo, Colusa, Sacramento, Solano, and Sutter. We are your experts for palliative and end-of-life care. Please reach out to us directly if you have questions in this chapter of your life for you or your loved one. We are here to support you. Remember, hospice is a choice and not all hospices are the same. Please ask for Yolo Hospice by name. I would like to introduce our volunteer manager, Andrew Moore, for a few words. I'm going to stop my spotlight. There he is.
Hello, thank you so much, Louise. Volunteers play a crucial role here at Yolo Hospice. So if you enjoy the presentation we're doing and the work that we're doing here at Yolo Hospice, please reach out to me. Whatever makes your heart sing, we're going to find for a place for you as a volunteer here at Yolo Hospice, whether that's for patient care, floral deliveries, our Pet Peace of Mind program, or even administrative support. My contact info is going to be located right below in the chat. Thank you.
Great. Thank you, Andrew. We will be utilizing the following Zoom best practices to ensure a successful workshop. All participants are muted. Presenters will unmute themselves when it is time to present. Please use the chat box for your comments and questions. To ensure a safe and secure meeting, we are asking that participants do not post any links in the chat box, as Yolo Hospice cannot guarantee the security of those links. Please only click on links posted by Yolo Hospice. The goal of this workshop series is for all participants to complete their 5 wishes by the end of the 6-week program. We'll be working with the material 1 wish at a time, and we ask that you complete the work from each week before the following week's session. We do check in with you at each wish to confirm that you have completed the previous wish. We do have Spanish support here today, so if Spanish is your primary language, please feel free to drop questions in the chat in Spanish and we will address them in the Q&A. The link to your free digital copy of the 5 wishes was included in the email we sent you. We will be posting this link in the chat box. The 5 wishes is a fillable PDF document for your information, or you may also simply print it off and fill in your information offline. Now, I'd like to introduce you to today's presenters. We are proud to partner with Aging with Dignity, the makers of this workshop's 5 wishes. Today, we are joined by the president of Aging with Dignity, Paul Malley, who will guide you through the first wish, the person I want to make healthcare decisions for me when I can't. I'd also like to introduce Alison Kent from Listen Inc. for joining us today. Alison will graphically record your questions and comments. Please use the chat box for comments and questions during the presentation. Your names will not be used in her drawings. Paul will utilize Alison's graphic recording for the Q&A portion of our workshop. Alison, can you just please share your screen and show us an example of your work? I'm going to remove my spotlight so you can go up. Wonderful. Thank you, Alison. For those questions that do not get answered during the workshop, we will continue to work with Aging with Dignity offline and get them answered. We will then forward to you via email a picture of Alison's graphic recording of wish 1 with your questions answered. Before we begin, please answer the short poll survey coming up on your screen. It will provide us with important data as to where you are at with your advanced care planning process. And we do utilize the information. I think I'm going to remove my spotlight. Liz is going to be posting the poll. Are we having technical issues, Liz? We're not seeing it.
No, it's up. It's up.
Oh,
We're at 53%.
oh, great. It's not on my screen. That's interesting. Great.
I think I'll stop it now. Oh, one. Okay, I think we're good. I'll stop it now.
Okay, great. Thank you. Okay, and now I'd like to turn it over to you, Paul. Take it away.
All right. Thank you, Louise. It's great to be with everyone. Good morning to you. I'm happy to be with you, and I'm joining you from the East Coast. I'm based in Florida, where our nonprofit organization, Aging with Dignity, is headquartered. But we are grateful to have worked with and partnered with Yolo Hospice for many years now. These presentations started in person many years ago. Louise and other volunteers and staff from Yolo Hospice have given these types of presentations all over the Sacramento Valley area. And then last year, when it was more difficult to gather in person, Louise and the team there created this virtual 5 Wishes presentation. So we're happy to welcome you to another round. And we're really looking forward to, and I'm looking forward to being with you over the next several weeks as we take each part of 5 Wishes, wish by wish, and give you some just practical guidance on how you can use it for yourself, your family, your friends, anyone who's close to you, anyone in your community. Once you hear this and you use it for yourself and with your own family, you can hopefully spread the word to others. Just to give you a little bit of background on where I'm coming from, I've been part of Aging with Dignity, working with this nonprofit organization and primarily focused on 5 Wishes and advanced care planning for a little over 20 years now. My heart attached to the mission of this organization, I'd say primarily because of my experience with my own grandparents and seeing both some of their challenges and struggles when it came to aging and their health, as well as a lot of the beautiful moments that I remember sharing with them. And a lot of those beautiful moments were very simple. They were just sitting together, being together, holding a hand. We'll talk more about this, but I just want to begin by introducing kind of what my own motivations are and my own inspirations, and that was experience with my own family and the people who I love the most, and seeing how important it is, how useful it is, how helpful it is if we can talk a little bit about what's important to us and tell the people who are close to us, so that if an illness comes up, the people around us aren't wondering what we would have wanted and grasping at straws. This, of course, came up front and center over the past year and a half as we've all been walking down this road of pandemic, and many of us might have had the experience of having a loved one who is hospitalized. I did. Both of my parents were hospitalized, both for a regular scheduled surgery my mom had last year that was complicated by visitor restrictions. I couldn't be there as much as I wanted to with her in the hospital because of COVID restrictions. And then eventually in the early part of this year, both my parents actually had COVID and my mom was in the hospital. And thankfully she's home and doing okay now. But I just mentioned that because even after talking about this for a couple of decades, it definitely became very real when I was thinking about it and working with the reality of what does it mean if my own mother is in the hospital and if I can't be right next to her during these times of healthcare challenge and decision making that has to happen, and how do we navigate that? So as we talk over the next few weeks, I'll bring some of that experience to you, and more importantly, I think what I'll bring to you is the experience of other families and people who have contacted Aging with Dignity over these past couple decades and relayed their stories to us, because I kind of consider myself just very fortunate to be able to be the listener of those stories, to hear those stories, and then to convey them back to you so that you might be able to learn something from it that's helpful to you. So I'm going to jump into our presentation today. And if all the technology connections work well for us, then you'll be able to see what I'm seeing. Are we good? No, we're good. Great. So just by way of background on our nonprofit organization, Aging with Dignity, was founded by a man named Jim Toohey, and Jim was legal counsel to Mother Teresa of Calcutta for 12 years. He assisted her with legal work and the Missionaries of Charity, the Order of Sisters that she founded, dealing with immigration work, building and permitting when they opened new homes. But more important than that, in his first encounter with Mother Teresa in Calcutta, she told him, asked him, encouraged him to go visit her home for the dying. It was called Kalighat in Calcutta. And he went to that home, a home that was caring for men who were near the end of life. And that experience changed his life, just being at the bedside of people who were very sick and seeing what was important to them, seeing how important it was not just to get the best medical care, which wasn't available in Calcutta at the time, certainly, but how important it was to simply honor that person's human dignity, honor their worth and their value, and find ways to show them that their dignity is honored. And I mention that because that is the inspiration that's baked into who we are, baked into Aging with Dignity. It's baked into 5 Wishes, as we'll talk about, because at the heart of it, even though we'll be talking about legal considerations and healthcare and medical and clinical issues, at the center of it is the human person, each of us, and the people who we love, what's important to us, and unpacking that and leaving a trail. You'll hear me sometimes reference a breadcrumb trail because sometimes that's what 5 Wishes becomes, the pages as we fill it out or the conversations that we have. We're leaving a trail so that the people who are close to us and our healthcare providers will have some instruction from us if we're not able to speak for ourselves on what's important to us. So we introduced 5 Wishes, thinking that if it could help a handful of people, that would be worthwhile and it would be great. Well, now 20 plus years later, we've provided 5 Wishes to 35 million people all over the United States, all over the world. It's available in 29 different languages and also in Braille. And I know that Louise mentioned that if you're participating in this session today, Yolo Hospice is providing 5 Wishes to you, a digital version, and the link is already included in the chat. If you have any problem with that, don't worry. You don't have to have it right now. You can try to click on it and open it up after the presentation. That's fine. But it's great, wonderful that Yolo Hospice is providing that to you for you to be able to use. When we first wrote 5 Wishes, created it, and we looked at the research that was out there that asked people the question, what's important to you? If you were very sick, and especially if you were approaching the end of your life, what would be most important? And these are some of the things that people said. They said, I'd prefer to be in my own home if that's possible. For some people, that's right. Other people would have a different preference. They might not want to be at home. They might want to be somewhere else, whether it's a hospital or an inpatient hospice house, something else. Many people say, I don't want to be in pain. And we'll talk more, especially when we talk about Wish 3, about how you can convey some specific preferences so that your family and your doctors know exactly what to do. And people also think of other people, the people around them, whether it's friends or family, if they'd like someone to be with them. And they also say, even if I'm not able to speak for myself, I still want decisions about me to be made based on what's important to me. In other words, I still want to have my finger on the scale, so to speak, when it comes to decisions that are made for me, even if I'm not able to speak for myself. And that's what 5 Wishes winds up doing, is that it helps to convey, again, those breadcrumbs, however you want to call it, the evidence, the information that gives people guidance to know what would have been important to you if you could speak, if you could make your own decisions. So here's the unfortunate contrast. Those things that I said people often say matter the most, those are sometimes the things that people don't receive, oftentimes because they just never talked about it or asked for it. We know that still in America, most people die in a setting that's different from their choosing. Some people, if asked, would say that they would not want to be in an intensive care unit hooked up to tubes and machines that they would maybe rather not be. And we also know that most people have not filled out any sort of advanced directive or living will. Most people have given no written indication to their family or to their doctor about how to make decisions for them if they're not able to speak for themselves. So in a nutshell, what we see is that there are a lot of things that are common that most people say, yes, here are the things that I want. I want to be at home. I want to be comfortable. I want people that I love around me. Don't want to be in pain. And then we see the contrast that says sometimes those things don't happen. And then we see this kind of disconnect that says, well, even though people have an idea of what they would like and what they don't want, most people don't talk about it and say anything about it. So that's where we're going to drill in today, is how do you talk about it? How do you communicate to the people around you and your doctor, your future healthcare providers, what's important to you, so that as much as possible, the things that are important to you, the things that you do want, that you're able to get that, and that you can avoid the things that you don't want. Here's a quick kind of snapshot of what we hope 5 Wishes provides for you. When we first created 5 Wishes, we thought, well, it would be helpful if it could be understood. We looked at legal documents that were out there, state-specific living wills and advanced directives, and to be honest, they were filled with so much medical and legal jargon that it was really hard for me to imagine sitting down with my parents or grandparents and talking about it together, because you can imagine this, if something is hard to understand, difficult to understand, it's hard enough to just sit down and put your glasses on and read it and understand it for yourself, but it's even harder to sit around together as a family and talk about it. So that was one of our main goals when we created 5 Wishes, was to have something that was simple, easy to use, written in everyday language, a focus on peace of mind, something that you could use, that any person, any family could use to sit down and talk about it with the people who are important to them and feel like you're qualified to do it. And you're certainly qualified to talk about what's important to you. You are the most qualified person in the world to do this. What we want to provide is just the platform, the stage, the document that guides you in that process, so that what you know best, you can convey to the people who need to know. We also wanted to make sure that 5 Wishes address those personal, emotional, and the spiritual wishes that people say matter the most, but usually aren't included in typical advanced directives. And we'll talk a little bit more too about what you would do if you have an existing living will or an advanced directive and you want to use 5 Wishes along with it. Which reminds me, as we're talking right now, keep in mind that in the second half of this presentation, we'll turn to your questions. So anything that pops into your mind, feel free to add it into the chat at any time. And then when we get to the second half of the presentation, when we're looking at questions, we'll have those ready to go. On the legal side, we worked with the American Bar Association, and they helped us to review the legal statutes for advanced directives in all 50 states, so that we can make 5 Wishes satisfy the legal requirements in as many states as possible. So today, 5 Wishes meets the legal requirements in 44 states, and that includes California. If you have family members in a different state, say Oregon, for example, they can still use 5 Wishes, but in Oregon, the law requires them to use a state form as well along with it. So bottom line is, in 44 states, including California, 5 Wishes meets all the legal requirements for an advanced directive. You wouldn't need to have or fill out an additional state form. As you're looking at 5 Wishes, the page 3, actually, after you look past the front cover, there's a box there that says 5 Wishes states, and it lists the 4 states that have additional requirements. Sorry, the 6 states that have additional requirements. As I mentioned too, what we hope 5 Wishes offers to you is not just a legal document or a conversation document, but really something to help you grab onto and hold on to your human dignity. because it lets you say, here's what human dignity means to me. And if anybody wants to help me do that, if I'm sick, and if I can't speak for myself, here are the ways that you can do that. And that way, we're less likely to feel like we're anonymous, like we're just an object on a healthcare conveyor belt, that we're known and loved and cared for. And that's usually the desire of the people around us, whether it's our family, our close friends, the nurse who's at your bedside, the doctor who's caring for you. In almost all cases, I think we're all united by this desire to take good care of people who we love, whether that's family or whether that's the person who we're caring for and we're working in healthcare. The challenge then is understanding, well, what does that mean practically? What does it mean? How do I do it? That's where the rest of 5 wishes comes into play. Then after you fill out this document, then what we hope you'll do, and you can do it over the course of these next few weeks, is make sure you talk about it with the people around you. Anyone who would likely be involved in caring for you, that's a person to talk with about 5 wishes as you're filling it out. So as we look now, we're going to really dig into wish number 1, which is the kind of the meat of our discussion today, before we get on to wishes 2 through 5 in the next few weeks. But just to give you a little bit of a map of where we are today and where we're going. Today, we're going to focus on wish number 1, naming your healthcare agent. Then, as we talk about wish 2 next week, we'll talk about medical treatment preferences. And then the 3rd, 4th, and 5th wishes in the next few weeks, we'll talk about comfort and who you'd want to be with you, what you want your family, your friends, your loved ones, your medical team to know as they're caring for you, and also your preferences for what you'd like to happen after you've passed away. That includes things like, would you prefer to be buried or cremated? Do you want a funeral or a memorial service? Those types of things. So I put that out there just so that you see the radar and where we are today. So now we're going to drill into wish number 1. You'll see at the top here, the headline says, wish number 1, the person I want to make healthcare decisions for me when I can't make them for myself. And I think that says simply what this wish is all about. Legally, if this were just a standard legal form, it would have a headline at the top that says, durable power of attorney for healthcare. So you can see there how we've changed the language around a little bit. And on this page, you can choose a first choice for your healthcare agent, and then a second and a third choice too. So in a nutshell, what you're doing here is you're picking somebody who would be your voice if you're not able to speak for yourself. And you're picking one person and then also backups in case that person isn't available or able to make decisions for you. The little terminology. If you're familiar with living wills or advanced directives, or if you have an existing form, you might see some of these other terms used, either healthcare agent, healthcare proxy, healthcare surrogate. All of that points to the question of who's the decision maker if you're unable to give guidance for yourself. On the second page of wish 1, you'll see a long list of bullet points. And each of those is a different power, an ability that that healthcare agent would have to make these types of decisions for you. Could be about the type of medical care that you're getting, interpreting your wishes, moving you to a different location, hiring and firing your healthcare providers. What's written there is really a broad list of powers that healthcare agent could have. If there's anything that you see that you don't want your agent to be able to do for you, you just cross it out. If you want to limit their power, their ability to make decisions for you, you can cross any of those things out. On a practical sense, I'd really encourage you, if you're inclined to cross something out, just think about it twice. Think about it from the perspective of, why would I not want my healthcare agent to be able to do this thing for me? Because remember, you are leaving a trail here. So if you cross something out, that tells your healthcare providers, anybody who's involved in your decision making, that you specifically don't want that healthcare agent to be able to, say, consent to care or make medical decisions for you. If you cross something like that out, that introduces the question of, well, why are you naming them as your healthcare agent to begin with? So I'm just shining right now the yellow caution light that says, if you're going to cross something out there, know that you're limiting the authority and the power of your healthcare agent. And you're perfectly welcome to do that. That's the idea. This should reflect your wishes. Just give it a second thought and make sure that that really is your desire, to limit their authority. When should you choose your healthcare agent or even update your healthcare agent? Bottom line is, everybody 18 and over, every adult should have a designated healthcare agent. And that's important to know, because these questions come up, the decision maker question comes up even before somebody's near the end of life. We saw this with COVID, when people were brought in or coming into the hospital, especially because they couldn't have family members by their bedside. It was very important to make sure that every person had a designated decision maker, a healthcare agent, because even if they were not able to speak for themselves for a short time, the healthcare team needed to know, who do we call? Who do we ask? Who has authority to make decisions for this patient if the patient can't communicate even for a short time? For young people, this comes up in cases of accidents, car accident, work accident. Hopefully none of these things happen, but they do happen sometimes. So if you're talking about this with your family, your adult children, your adult grandchildren, this is something, this conversation, the whole 5 wishes conversation, is not something that is only intended for people who are of a certain age or have a certain medical diagnosis. It really is intended, and it's helpful for all adults. So everybody should have this conversation, and it's important to update it too, and to revisit it, especially if there's a change, a big life event. If somebody in your family has passed away, if somebody who you named as your healthcare agent has died before you, births of children, divorce, new medical diagnosis, it's important that you revisit your documents. And even if this is something that maybe you did with an attorney as part of your estate plan 2 years ago, 5 years ago, 10 years ago, there's no expiration date to those documents, but they do age, and sometimes they don't age well. So go back and look at them. Make sure that if you have existing documents, that they're updated to reflect your current wishes today. And if you have a document that's 10 years old or more, it would even be a good idea to update it so that it has a more current date on it, so that it's more recent. As you finish 5 wishes, and I just put this in here just in case you're not with us in the last section, but I just want to make sure that we all know the importance of not only writing the document, filling it out, signing it, and witnessing it properly on the back page, but also talking about it with family. And you can do this today, actually, even before you complete your 5 wishes, but you can go to 5wishes.org/activate. The website 5 wishes, spelled out FIVE wishes.org/activate, and just provide your name and your email address. And that way we can provide updates to you. I think you also have to add your state, because then if we have your state, we can give you updates if there are any state specific news, information, or changes that you need to know about. Also, if there are any additional resources, guidance, or help that you need, know that we're here to do that. I know Yolo Hospice has wonderful resources that are provided locally in the community. And as part of our partnership with Yolo Hospice, we're also happy to give you any guidance that you need in filling out 5 wishes. There's a national toll-free number that's up on the screen now. 1-888-5-WISHES, and also our website, 5wishes.org. There are documents available in many different languages, as well as conversation guides to help start conversations and use 5 Wishes to have those conversations with your family and the people who are close to you. So just to tie it up before we switch over to looking at your questions in that discussion, the important part of wish number 1 really is in giving thought to who you could name, who you trust to be your healthcare agent. And sometimes it's not the first person who pops into your mind. We hear this a lot of times from families where they say, you know, I thought that my healthcare agent had to be my spouse. But then when I thought about it, I realized there might be somebody who's in a better place to be able to help me with making these types of decisions. So give thought to picking the right person, whether it's the closest relative, closest friend, an acquaintance, somebody who has some backbone and who would be able to stand up for you and honor your wishes and know your wishes that you fill out in the rest of 5 Wishes. So with that, I think I will, I'll turn it over to Allison, and we'll take a look and see what's being chatted on the chat.
Right, I'm about to share my screen here. Okay, so Paul, the first question is, can I list myself as first choice if I don't have relatives or friends I'm comfortable asking to be my agent?
Good question. So you wouldn't need to list yourself, because as long as you have legal capacity to make your own decisions, you're in control, no matter what you write in 5 Wishes. If you've named somebody else as a healthcare agent, they're not acting as your healthcare agent until you're not able to speak for yourself. So, so as long as you have legal capacity, you are the decision maker for yourself. You also don't have to name a healthcare agent. You could cross out that section, so that indicates that you've intentionally decided to not name a healthcare agent. But if you choose that route, it's important to know that if you don't name a healthcare agent, there are state laws that basically point to next of kin connections as authorized decision makers. So if there's ever a situation where a healthcare team, your healthcare providers are trying to make decisions for you and you're not able to speak for yourself and they need somebody to make a decision, they will look at that law and try to contact someone who has a connection to you. That's, to some people, that's a surprise, because in many cases they might be able to find somebody who is who has a legal family connection to you, but maybe you haven't been in touch with that person in a long time, and that would mean that that person is probably not the best person to know what's important to you and make decisions for you. So so just be aware of that that you can choose not to name a healthcare agent, but if your healthcare team needs to make a decision and there's nobody to speak for you, they will go look to try to find someone who has that legal connection to you, most likely as a family connection. So oftentimes, you know, I know that some people might choose to ask a neighbor, an acquaintance who maybe not come to mind as their, you know, closest friend, but somebody who's willing to accept the responsibility of making that healthcare decision. Sometimes if an acquaintance is asked to serve in this capacity, their first thought might be, well, I'm not close enough, or I don't know you well enough, or I don't want to take on any legal responsibilities. But it's also important for that person to know that when you're serving as a healthcare agent, you're not taking on any financial responsibilities or liabilities or concern. You're simply helping to translate the wishes that a person has hopefully already written down in the rest of 5 wishes to make sure that they're acted on. So that brings me to the last point of this question, and that is that if you choose not to name a healthcare agent, that increases the importance of the rest of 5 wishes. So if you choose not to name a healthcare agent, be sure that you give as much detail as possible, especially in wish 2. Because without a healthcare agent, the thing that's missing there is somebody to interpret what you've written. And you don't always need an interpreter, so it's okay not to have one. But then that means that whatever you've written in wish 2 is everything that your healthcare team will have to go on. So I would encourage you to use the blank lines on wish 2 to give any specific instructions. You can also attach pages. You know, if you're somebody who has very specific thoughts about exactly what you want to happen and exactly what you don't want to happen, and if that's not addressed in 5 wishes, then add pages to it. Say, C note attached. You can do that. You can write in the margins of 5 wishes. You can do whatever helps you to have a written record of what's important to you. Use that space to do it.
Okay, thank you, Paul. The next question, when is a notary required?
A notary is actually never required, but in some states, including California, a notary can take the place of 2 witnesses. So in California, you can use 1 notary in place of the 2 witnesses that would sign your back page of 5 wishes. So with 5 wishes, if you have the document or you're scrolling through it or you're looking at it, you'll see that wish 1 is just the beginning of the document. There's 1 signature on 5 wishes that comes at the end of wish 5. So that signature page, it's 1 signature page. That is the signature for all 5 wishes. So on that page, you'll want to make sure that you sign it, date it, and follow the instructions for witnessing or for notary.
Great, thank you. Does my agent need to live in the same country as me?
No, your agent doesn't need to live in the same country. They don't have to be local. They don't have to be close by. The most important thing is that, number 1, they know and they're willing to honor your wishes. And number 2, that they're accessible. So number 1, that they can know and honor your wishes. And number 2, that they're accessible. And I say accessible because you can probably connect the dots on this. If a healthcare team needs to contact that healthcare agent, with today's communication, they don't need to be standing in the hallway of an emergency room, but they do need to be able to take a phone call or do a virtual chat. In the past year and a half, the number of virtual consultations by FaceTime or Zoom or other virtual connections in clinical settings has skyrocketed. So they don't need to be local, but they do need to be accessible. If they're out of the country and very hard to reach, that would be a challenge. So for me, I put the emphasis on accessibility rather than geography, rather than location.
Great. So the next question is, what are the most important things to consider when picking a healthcare agent? What are good characteristics of a healthcare agent?
I would say the first thing would be a dedication to respecting your wishes, your wishes. So I'd underline or make your wishes the important part there. Because sometimes healthcare agents especially if they're named as a healthcare agent without any additional instructions. They may assume that their job is to make decisions for you based on what they would do for themselves. And that's not their job. Legally, that's not their job. Clinically, that's not their job. Their job is to be dedicated to respecting your wishes. And then number two would be the ability to ensure that your wishes are honored. And so by that, I mean, that points back to accessibility. They need to be able to be contacted. And I would say also, as part of that ability, that it requires somebody who has some backbone. You want someone who is able to stand up for you, somebody who's not afraid to walk or call the nurse's station and ask questions, somebody who's not afraid to challenge decisions that are being made if it's not consistent with your wishes. And that points to thinking back again about the right person to be your healthcare agent. Because I remember I mentioned my own family. With my grandparents, I do remember a discussion that happened between my mom and her parents. And both of her parents at the time were older. My grandfather was very sick. He was in the hospital. And the question was, who should the hospital contact if there's a crisis? Well, my grandmother also was older and becoming more frail and fragile. And it would have been very difficult for her to process information if she got a phone call in the middle of the night. So the decision was made to appoint my mom as the healthcare agent instead of my grandmother, even though she was the spouse. Legally, she was the closest family member, my grandmother. But as we thought about it, we realized, and she agreed, that she would not be the best person to contact in case of an emergency. And so that pointed back to my mom. So all of that goes to say, it sometimes is not the closest relative. It might not necessarily be a spouse, but you do want somebody who's accessible and who has that ability to stand up for you.
Great. All right, next question. How does power transfer to the agent?
It's a really good question, an important one. So on wish number one, at the very top of wish number one, it sets the criteria for when power is transferred for the agent. So in other words, when do they begin acting as your healthcare agent? And in 5 wishes, it says that my attending or treating doctor finds that I'm no longer able to make healthcare choices. So that first thing is that you no longer have capacity to make your own decisions. And that another healthcare professional validates that. So there's a second opinion. So what that means is that if you've named a healthcare agent today, so say right now today, I've named my wife as my healthcare agent, which is true. My wife is not the decision maker for my any healthcare decisions that come up for me today, because I hope I'm still of sound mind. I hope I'm of sound mind today. She can't walk into my doctor's office and ask to see my medical records if there's not a reason that she believes that I don't have capacity to make my own decisions. That's important for people to know, because that gives you hopefully a little bit of reassurance that by naming this person to be your healthcare agent, you're not assigning authority and control over to them today. You're assigning decision-making power to them only when you're not able to decide for yourself.
Okay, I think that is all the questions that I have. Are there any other questions that people have and would like to share?
I saw one pop up that actually relates to this, and it's an important one. It was asking about competency, and I would make a distinction, and it's appropriate here in this question too, the distinction between competency and capacity. So competency is a legal designation. And the only way to declare that somebody is incompetent to make their own, to retain their civil abilities to make decisions for themselves is through a legal proceeding. So competency is a legal proceeding. Capacity is a clinical designation. And sometimes this comes up in long-term care settings, especially in other healthcare settings, where a healthcare team might tell a family member, well, your loved one is incompetent. You need to have a competency hearing before anybody can do anything. And that's not true. And sometimes that leads to unnecessary legal proceedings related to competency that may not need to happen, because the question from the clinical standpoint is, does the person have capacity? Do they have the ability? Can they make their own medical decisions today? Also, capacity can change really from 1 minute to the next, from one day to the next. Whereas competency, once that's taken away, the person is determined to lack their own competency, they're incompetent to make their own decisions, then that's a legal change that's in effect until it's reversed legally, as opposed to the capacity decision that's a clinical determination. So I know that got a little bit into the weeds there, but it's often misunderstood. And I think the worst part of that is that it sometimes results in unnecessary legal proceedings that didn't need to happen.
Great. I don't see any additional questions. Does anybody have any other ones that they'd like to raise? Okay, well, I'm going to turn this back over to Louise, if I may.
Thank you, Allison. Thank you, Paul. Appreciate it. So yeah, we will go ahead. Before you leave, if you could take a few minutes to answer the next poll on your screen. Your answers are utilized to help us improve our programming. Please be sure to scroll down on the poll to answer all of your questions. And while that is happening, I would just like to remind you, if anybody is interested in volunteer opportunities at Yolo Hospice, please reach out to Andrew Moore. He has landed his contact information in the chat, and he would love to hear from you. And Liz, you can let me know when that poll's done, because I'm not seeing it on my screen for whatever reason.
Is anyone else seeing it? Because no one has answered.
Andrew's given a thumbs up, so.
Okay.
I wonder if it's because I'm on Spotlight that I'm not seeing it. Interesting. I'll follow your lead, Liz.
We're at 50%.
Okay, thank you all. We build our programming out based on your feedback, so it's very important to us. So we always appreciate you taking the time to give us this feedback, because we do make adjustments based on it. I think I'll just go ahead with our farewell. So we look forward to seeing you all next week, same time, same place, for Wish 2, which is the kind of medical treatment I want or don't want. Please remember you have homework. Please call 5 Wishes toll-free 888-594-7437 if you need additional support to complete Wish 1. And I'm going to land that in the chat box right now as we speak for everybody. How are we doing, Liz?
I stopped it. We're good.
Cool. So we look forward to seeing you all same time, same place next week. Thank you for joining us today.